Drill 10. Three-quarter catch-up with a pause. Timing is critical on this drill. Normal catch-up is often a popular choice for coaches, but it does not allow for hip rotation or an extended catch. A flat catch position is also a difficult starting point for developing swimmers, normally leads to a dropped elbow. Ensure that the swimmer stops before hand entry and then at speed and with precision completes the full stroke. This drill allows the hips to engage with the catch and a forward drive on entry. It also ensures that the opposite arm is engaged right past the hips.
Pectoral smash with auxiliary arm movement. The area that the swimmer should initially work through is from the edge of the sternum, which is just off the midline of the trunk, through to the front of the shoulder. Secondly, to work over the front of the shoulder, beginning just at the top by the clavicle, down to the bottom of the shoulder in the groove between the shoulder and the bicep. Thirdly, into the deltopectoral groove located between the shoulder and the chest muscle. The movement of the hockey ball should be a small side to side, up and down, or oscillating circular motion. The combination of these movements are best used to maximize tissue penetration and release. This form of localized pressure allows the hockey ball to knead into a specific area of the muscle. To increase the intensity, the arm can be brought behind the back. Also, leaning into the wall will allow control over increasing and decreasing the intensity. A second technique that can be used is the auxiliary movement of the arm whilst the hockey ball is held still in one place. This form of technique allows the hockey ball to work into a more global area of the muscle, by the muscle moving under the hockey ball rather than the hockey ball moving on top of the muscle, as in the first technique. This technique can be done, but is not limited to, arm movement that follows a forward, backward, and out to the side motion. The hand can also be rotated to allow a greater range of the muscle belly to be worked through. Matrix. Begin in a press-up position. Hands under shoulders, head and spine in neutral, the lower back must be flat, legs are straight, feet hip-width apart, and the swimmer is pushing back through the heels. The movement begins by the swimmer passing one leg underneath and placing the foot so that both feet are directly under the knees and are hip-width apart. Feet are flat and are pointing forward. The weight is distributed into the heels. The hips are brought as high as possible to fully activate the glutes. The upper arm points directly up towards the ceiling. This movement fully activates the glutes, increases range of movement at the thoracic spine and shoulder girdle. This movement is also effective at activating and developing strength around the scapula and rotator cuff. Thunderbolt pose 4. With a neutral spine, the swimmer lowers their weight back onto their heels to increase the intensity of the stretch over the front of the ankle joint. The swimmer must ensure that the feet are pointing directly back. The toes should not be pointing towards each other. Side plank with band high fives. The swimmer sets themselves up into a position where the head, shoulders, hips and legs are aligned. The hips are tucked into a strong lumbo-pelvic neutral position. The elbow of the supporting arm is directly under the armpit, with the shoulders set back and down into a strong scapular neutral position. The opposite arm is set into a position with 90 degrees at the shoulders and 90 degrees at the elbow. While maintaining a high elbow, the swimmer rotates the arm from the shoulder as far as possible without compromising the scapular neutral position. Split squat adductor brace. As the swimmer splits their stance into the split squat start position, the feet should remain hip width apart. If the feet are brought in line, this will decrease the stability due to narrowing the base of support. This will increase the difficulty of the exercise. In order to increase the activation of the adductor, a band is tensioned and placed on the lead leg just below the knee. The movement begins with the swimmer upright, head, spine and hips in neutral, shoulders and hips facing forward. The lead leg and trailing leg have a slight bend to minimize stress to the knee. As the swimmer squats down, the knee should not pass beyond the toes of the leading leg. The knee should remain in line with the foot and hip throughout the movement.